A prop respiratory therapist will have set you up with all of the necessary equipment. This video is a visual review of how to complete breath stacking with an ambu bagger to assist with coughing. This technique can be especially helpful for individuals with weakened cough reflexes or difficulty clearing secretions from their airways. Stacking these breaths will help build up pressure in the lungs, which can assist with a more forceful cough. The ambu bag is a manual resuscitator commonly used in medical settings. It consists of a self-inflating bag, a one-way valve, and either a mouthpiece with nose clips or a mask. The self-inflating bag allows you to provide breaths by squeezing and releasing. The valve system helps control the flow of air. First, attach the one-way valve to the bag. Next, attach the flex tubing, followed by the mouthpiece. For mask use, first attach the one-way valve, followed by the mask. The best position for this procedure is in a comfortable semi-upright or fully upright position. This helps promote better airflow and makes it easier to cough. First, we'll look at the mouthpiece technique. This technique can be performed alone, depending on arm strength and dexterity. To create a tight seal, insert the mouthpiece between the teeth and the lips. Keep a tight seal around the mouthpiece so that no air escapes around. Nose clips can also help eliminate any air escaping through the nose, allowing all of the air to enter the lungs. So you can put your nose clips on. Nice tight seal. Squeeze the ambu bag at the same time your member is breathing in. Deliver a slow, deep breath. Hold the breath for a few seconds to allow the lungs to fully inflate. Without deflating the lungs, allow the bagger to reinflate and deliver another breath on top of the first. Continue stacking breaths, pausing briefly between each one. The goal here is to deliver a larger volume of air into the lungs, preparing for an effective cough. Continue this process for 2 to 5 breaths, gradually increasing the volume of air in the lungs. Finally, take the mouthpiece out of your mouth and cough. The mask interface is very similar but will require assistance. It will work best if you have a headrest to support the back of your head while holding the mask on your face for a tight seal. Follow the same steps as those mentioned for mouthpiece. Okay, so what we're gonna do is I'm gonna make a nice tight seal with this mask on your face. I'm gonna get you to rest your head back just so that we can get enough pressure to create a tight seal. And I'm gonna get you to take 3 breaths in a row. So I'm gonna squeeze the bag on 3. You're gonna take a breath in on 3, and then you're gonna hold your breath. Then we're gonna count to 3 again, take another breath in, continue to hold. On the 3rd and last breath, when you're nice and full, I'm gonna take the mask off and you're gonna give me a nice big cough. Okay? Good. Awesome. So rest your head back, and I'm gonna push a little bit forcefully here just to make sure we've got a nice tight seal. And again, we're gonna take 1, 2, 3, hold, 1, 2, 3, hold, 1, 2, 3, and then we'll take it off and cough. Okay?
Sounds good.
All right. 1, 2, 3.
Hang on. Feels like it's leaking around.
Leaking a little bit around your up here. Okay, so I'm just going to push a little bit harder and just rest your head back there. Okay, awesome. 1, 2, 3. 1, 2, 3. 1, 2, 3. And cough. Awesome. How did that feel?
That felt pretty good. Yeah.
Okay, great. This technique takes practice and coordination, so don't be discouraged if you're unable to complete it the first time you try. Make sure you're communicating with your member throughout. Please see the other video on how to use the ambu bagger for maintenance and recruitment of the lungs. Prop is always available by phone during business hours to answer any questions.